Welcome to the parshealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about a faster way to rid muscle knots in your neck and shoulders. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. A muscle knot, which has been known as a trigger point, is an area of sore muscle. It forms when muscle fibers compress and contract. Even when they aren't moving, you may experience pain. Your neck is especially prone to muscle knots. This happens because many daily actions, like texting on the phone or working on a computer, can take a toll on your shoulders and neck muscles. Knots in your shoulders or neck can also develop due to having a sedentary life, physical inactivity, and emotional stress. Because muscle knots often have pain, it may feel uncomfortable to move your shoulders and neck. Fortunately, there are several ways to treat it, like simple self-care measures, massages, stretching, etc. They help you find relief. Here's a look at 5 easy ways to help relieve a painful knot in your shoulders and neck. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Muscle knots causes. The most common causes of muscle knots in your shoulders and neck include poor posture, a sedentary lifestyle, unhealthy eating habits, overusing or injuring your muscles, prolonged sitting, dehydration. Stress and anxiety may also contribute to muscle knots. Muscle knots can happen anywhere in the body, but they mostly occur in the back, shoulders, and neck. Muscle knots can cause severe pain in your neck and other joints. When you touch a muscle knot, it may feel tense or bumpy. It can also feel tense and tightened, even when you're trying to rest, and they're often sensitive to the touch. Muscle knots can have symptoms in areas outside and around the muscles, including headaches, toothaches, and earaches. Self-treatments. Number 1. Stretches. There are several stretches that can help you prevent muscle knots, and if you already have one, you can ease its pain. Cobra pose. Cobra pose benefits from correcting posture. It functions by extending the chest muscles, which balance slouched shoulders. The extension motion of this activity also aids ease back and neck discomfort. To do this stretch, lie down on your belly. Put your hands beneath your shoulders. Fingers should be facing forward. Slowly squeeze your glutes. Push up from the floor, gradually expanding your chest upward. Make sure to maintain your pelvis pressed to the floor throughout the motion. Hold for 7 to 15 seconds. Relax and return to the starting position. Cat-cow. This is a classic yoga pose that stretches the neck and shoulders muscles. It affects flexing and extending your spine, supporting posture, balance, and mobility. To do this stretch, you should be on all fours. Put your hands underneath your shoulders and your knees under your hips. Inhale. Drop your stomach down, raising your chin to the ceiling. Exhale. Round your back, driving your chin toward your chest. Repeat for 30 seconds. Shoulder shrugs. The shoulder shrug is a movement that targets your neck, shoulders, and spine. It applies gentle shoulder moves, which relax the surrounding muscles. To do this exercise, sit or stand up straight. Inhale. Roll your shoulders up and toward your ears. Pause. Exhale. Lower your shoulders back to the starting position. Repeat 2 to 3 sets of 12 repetitions. Number 2. Muscle knot self-massage. To relieve a muscle knot, do a trigger point self-massage. This applies by pressing the knot to loosen tight muscle fibers. Self-massage tactics can occasionally aid to soothe muscle pain. Gently making small circles operating your fingers in the knot area can help ease the fiber bundle. If you're having trouble getting the spot, using a foam roller or tennis ball in a back and forth movement can be practical. Here's how to do it. Put your fingers on the knot. Apply firm pressure for 10 seconds, release. Repeat for 5 minutes, up to 6 times a day. Repeat every day. Number 3. Heat or ice pack. Using heat or ice packs may reduce the muscle pain a knot causes. Ice can help decrease inflammation in and around the knot. Heat may aid soothe and relax the muscles. Use whichever remedy gets the most comfort, or try alternating between the two. Some people succeed by using a mixture of hot therapy and cold treatment. With cold therapy, the focus is on using ice packs directly after seeing a muscle knot forming. Suppose you've been living with pain from a muscle knot for a few days. A warm compress can help relax the pressure you feel in the muscle by stimulating blood circulation. When operating this therapy, make sure you cover the heat or ice pack in a towel or cloth to protect your skin. Use the heat or ice pack on the irritated area for 15 to 20 minutes. Repeat several times a day. You can try operating a heating pad, hot water bottle, warm or cold compress, ice pack. Number 4. Nonsteroidal anti-inflammatory medicines, NSAIDs. Nonsteroidal anti-inflammatory medicines, NSAIDs, are painkiller medicines available over the counter. They function by lowering inflammation, which prevents pain and swelling. Instances of NSAIDs include aspirin, ibuprofen, naproxen. Although NSAIDs can control muscle knot discomfort, the relief is not permanent. They function best in a mixture of trigger point massage and stretching. Number 5. Rest. Let your body relax if you have muscle knots. Take a break from any movements causing the knots or enhancing your pain or affliction. Spend as much time as possible relaxing. This may contain sleeping longer than usual or lying in a comfy position utilizing cushions to support your body. If you have a knot in your neck, try massaging the area with your fingers using heat or ice. Do healing neck movements, like shoulder shrugs, or stretches, like head-to-hand release and cat-cow. When done regularly, these activities may help relieve the pain and strain. To stop future knots, stay active and stretch often. If the knot keeps coming back, see your doctor or physical therapist. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.